Distribution, okay. When you talk about distribution, the exam, distribution, what do you think they ask you about in Viva? We start with volume of distribution. Can you tell me something about volume of distribution? Volume of distribution is an apparent volume, like it's not real. See, apparent volume. When you drug, it need to be uniform distributed. Observe. It is. You can read. Now, the reason you're here is you want to pass the exam. Betul lah. When you see volume of distribution, what is in your mind now? Let's say, Viva, I ask you, tell me something about volume distribution. What do you think is in your mind now? What do you think is in the examiner's mind? Examiner's mind. What do you think he will ask you? You know what I'm trying to do now, not? So that makes your studying meaningful also. If you know what the kind of thought examiner, when you read, it is not so meaningless. Otherwise, you look at the notes, you read few pages, you will start to fall asleep. Correct? Then you know you have to finish the syllabus, you continue reading, but actually nothing go inside. Right? Betul not? You think I've been a student before, nothing go inside. Think about it. You say, I finished already, but nothing go inside. Then maybe why you start kosong. But if you know, this is called active learning. And active learning is we're trying to enter the examiner's mind. So sometimes, see, what is the volume of distribution? So what is the thing? This is the most important. Indicate extent of the where the drug has gone. Look at this. See, I actually spoon feeding you so nicely. See, when you talk about volume of distribution, if you do not know what is the ECF volume, actually it's a better slide, but no space put there. It's the PowerPoint one. This is from the ECF later. See, you must know how much your total body, your plasma ECF. So, if the volume of distribution is, see, this is total body volume is 45 liter. The total volume, apparent volume of distribution is, let's say, 70, 80. What does it mean? 70, 80. See, your body water is only about 45 liters only. If I say this drug, total body volume is 80, what does it mean? It's in the fat. It's in the fat. That means this is a very fat soluble drug. If the total volume is just, let's say, 5 liter, what do you mean? What do you think? What drug? So let's see, you have to go there. So you have to know that. So that means that is you have to know. But sometimes the student get caught. The problem is that they jam. They jam because sometimes the examiner can tell you a bit. What is the total body volume of the total body? Some numbers. The numbers. Okay, because if you don't know these numbers, how do you know? Okay, if I say it is 80, and you do not know that the total body volume is about 45, you cannot compare. So that means certain numbers you must put into your mind. You understand what I mean? So now if I just walk around, I've got this drug, total volume 100%, say, wow, fat all over. Implication, metabolism, all these sort of things. Now, another question they like to ask, how to calculate CO? Another question they like to ask, go ahead, next here. Another question they like to ask in Viva, see, volume of distribution equals to dose given, thereby the initial concentration. Another question they like to ask, how to calculate CO. remember there's a graph, concentration time. If you draw a graph, see, I'll show you back again. Concentration time. Okay, like that. So how do you get concentration at time 0? Concentration at time 0. This is a YY question. They like to ask. Sometimes we see for as an examiner, sometimes we get a bit bored, very boring, sit there for days. We like to entertain ourselves. Entertainment, what's the name? Like this, entertain. Okay, how do you calculate the concentration at time 0 so that we can see if we can laugh or not? Inside laughing. So we like to entertain ourselves because there's nothing to do, not so boring. So you must not let us laugh. You must make us open the mouth. Oh, wait, this fellow know. So we have to find more challenges to entertain ourselves. How do you find? 0. Anybody? Oh, lucky, man. This come out, give me a treat, man. Any idea? Must get thick skin, on the pass. Any idea? Any idea or not? You're just beginning only, is it? Beginners, Mainly beginners, Okay, very important. For those who, all the mangsa, remember, you need to study 2 full years. Really have to study 2 full years. I think probably the minimum 1.5 years have to read very, very hard. You have to sacrifice everything. Sacrifice everything. Seriously. Everything. Total sacrifice. If you are a genius, maybe 1 year, 3 months. You're a genius. Because how genius you are, I think we are a bigger genius. You can unlock your brain easily. So you really have to study. Pure sacrifice. If I'm not, pure sacrifice. You need at least, for the average student, really 2 years. I know it's very difficult. For the workload, I know it's very tough, but you really have to study very, very hard. See what I'm asking you are the questions that you should know, like tip of your finger at the end of 2 years. Tip, because you're going for an exam. Betul, I know some start to cry already. Cry already. But failing is normal, especially this exam. It's not MBBS. MBBS, we try to help you. But if you follow the program nicely, you should be okay. See what you do. This is concentration. You lock here. When you lock, this curve become a straight line. A curve straight line. So that means when you hit here, you get your CO. Understand not? Because you know why? Because when we give drugs, then we take blood sample. Take blood sample. So by the time we take blood sample, we here, correct or not? We here, but not here. How to take blood sample? So to get 0, you just lock. So why is the examiner asking this question? They say for fun. So it shows fundamental knowledge. Because later when you do research, you got to know what's the initial, understand not? Initial concentration. So this, you know what we like to ask. Okay, factors, same thing. See? You see, same thing. Factors determine volume distribution, factors determining absorption. See? Almost the same one. This is probably patient factor, drug factor. See? Lipid, ionization, molecular weight, protein binding. Factors, the physical chemical property of drugs. Lipid solubility, ionization, molecular weight, plasma protein binding. If it's highly protein binded, that means the volume distribution will be small. Cannot escape. Okay, then you must know what is the significance of volume or distribution. Okay, You can determine loading dose, which is the volume distribution at steady state. SS is steady state lah, not sungai senam or anything like that, steady state, times the concentration, the plasma concentration that you want. You can determine half-life. Half-life is 0.693. This is E lah. Volume distribution over clearance. SS for extracorporeal drug. What does this mean? What does this mean? What does this mean? What does this mean? Yes. What drug? You must use an example. You see, anytime you open your mouth, you must make sure you know how to answer. Otherwise, you just simply throw your mouth. These are tips. We will ask you because we assume that you know and we try to help you to pass. You don't simply throw thing, just talk like that. Oh, yes, tell me something about that. You die. So that means drugs that are high, volume distribution is very high. Can you take it out by dialysis? No, the flow is in the fat already. Unless you want to suck all the fat there, and then spin it. Correct? So that means if the drug has got high volume distribution, you forget it. Okay lah. Plasma protein binding. Okay. Wait. When you see, tell me something about plasma protein binding. Tell me something. This time we write short notes. Write short notes. Tell me something about plasma protein binding. Then you must know this, that is types of protein. Albumin, globulin, alpha-1, glycoprotein. Hey, imagine if you don't know this, tell me something about plasma protein binding. How many sentences can you write? So you must know the type of 1, 2, 3, and the implication. The implication of plasma protein binding, it is saturable. Saturable. And you give example. See? This is implication. See, maternal fetus. Only the unbind portion of the drug can cross. Only unbind portion can cross. Now, plasma protein binding. See? What is the problem? Drugs that are highly protein binded, when it comes to drug interaction displacement, is the most dangerous. For example, like warfarin. Warfarin, 99% protein binded. Can you imagine if you displace it 3%? See, 1% is already your active drug. Displace it by 3%, then 3%, you should die. Okay, so the more, let's say if the drug only plasma protein binded 50% only, 50% only protein binded. So if you just displace 1 or 2, it doesn't matter. Just like it's like the electrolyte, potassium and sodium. Sodium, let's say 140. If you become less, 140 become 138, any difference? Or 142, no difference. But let's say potassium, you're already at 5.5. 2 becomes 7.5. See, big difference, correct or not? So that means this protein binding only apply to those that are highly protein binded. See, competitive displacement, hypoalbuminemia causes this. And ionization, I told you already. Okay, then let me just go back a bit first. Now, you see, okay, good. I tell you the trend of mind. So, when the examiner asks you, tell me something about volume or distribution. Volume or distribution. How do you know the implication things that can follow? Let's say the volume distribution, the implication that it can follow. The determinant. See, the determinant, the drug factors, protein binding, right, ionization, Okay? So that means if I ask you to write a small little essay on volume of distribution, I don't tell you how much can you write. One or two sentences, correct? Volume distribution, apparent volume distribution is apparent this, that. That's it. You're finished. So that means when you write the volume of distribution, you know the definition, you know the implication. Let's say very big is in the fat, very small amount is in the plasma. And then you know factors affecting volume of distribution. First will be drug factor, then be fixed principle. And after that, your second part essay will be patient factor. Then after that, the patient factor, we always put it there, then the drug factor, and then you have to talk on plasma protein binding. You have to talk on ionization. Can you imagine, you never talk on, when I ask you volume or distribution, I ask you to write as volume or distribution, you have never prepared, and you need to discuss on patient factor. Patient later is heading only never discuss on plasma protein binding, discuss on ionization. Wow, you think die or not? Die instant death, man. Correct, That's why you see sometimes when we mark paper, kosong, don't write 1 or 2 only. But then later when we discuss like that, you know, I say, correct or not? But now when you read, it's understandable, easier to understand. Faham. So that means volume distribution, then the implication, the clinical use, to determine loading dose and half-life. Because this one, MCQ come up, between loading dose and maintenance dose. This loading dose, maintenance dose is different. Maintenance dose is this one times the clearance. So you see, at least you know the usage of this volume distribution. And plasma protein binding. Let's say we do a separate question, write short notes, plasma protein binding. Then, wow, what do we write, man? Nothing to write. Betul, but you can write on the types of protein have albumin, globulin, alpha-1, and leucine. And then, okay, this one, MCQ. MCQ, they like to cheat you. They say, which one, does this bind acidic or acidic drug or basic drug? So confuse you in MCQ. This one, acidic or basic, confuse you in MCQ. So easy, remember, see, alpha-1, acid will bind base. So this one, just no one, that's just acidic and neutral. MCQ, always confuse you, MCQ. Let's give an example. And then protein binding, you must know that when you go, the maternal fetal is the unbinded portion that can filter through, just like your renal function, your glomerulus. Okay, interaction. See, plasma protein binding. Now see, later when you go back and read your paper, you will understand why you're reading it. Betul, rather than one isolated thing, don't know why this will put up there. Is it to show off knowledge or anything? No, it's a sequence. So to survive the Viva essay, you must, when you study, sit down, step back, and say, I'm the examiner, how am I going to ask this question? You remember I tell you, then you show pass. You understand why you need to know this and sequence of it. The sequence,